नमस्कार मंडळी. मी प्रसाद अथणीकर, महाराष्ट्र मंडळ शिकागो 2023 चा अध्यक्ष. आज फॉर एव्हर यंग चा आपला एक चांगला सेशन आहे. मी आपले एसी लिएजन माधवदादा गोगावले यांना विनंती करतो की आजचं सेशन चालू करावं.
नमस्कार मंडळी. मी माधव गोगावले. धन्यवाद प्रसाद. आज आपण खास विशेष प्रोग्राम आपल्या महाराष्ट्र मंडळातील शिकागो या त्याचप्रमाणे सर्वांसाठी हा एक सुंदर प्रोग्राम ठेवला. आज आपण सगळ्यांसाठी हा एक कम्युनिटी सर्व्हिस म्हणून हा आजचा सेशन असणार आहे. तर आजच्या सेशनमध्ये डॉक्टर लाडू याबद्दल आपल्याला भरपूर माहिती देतील. पण त्या अगोदर मी डॉक्टर रेखाताई देवधर यांना विनंती करतो की तुम्ही डॉक्टर लाडूंची ओळख करून द्यावी.
नमस्कार मंडळी. डॉक्टर लद्दूंची ओळख करून द्यायची म्हणजे खरं म्हणजे आपल्या शिकागोचेच ते रहिवासी आहेत, आपल्या मंडळाचे लाईफ मेंबर आहेत, तेव्हा काही जणांना त्यांचा परिचय आहेच. पण ज्यांना नाही किंवा त्यांचं जे एज्युकेशनल बॅकग्राऊंड किंवा आता ते काय करतायत ह्याची माहिती काही जणांना नसेलच आपल्या इव्हन शिकागोतल्या लोकांना, तर ती मी करून देणार आहे. डॉक्टर अतुल लड्डू यांच्याकडे ग्वाल्हेर युनिव्हर्सिटीचे MD कार्डिओलॉजीमध्ये त्यांनी केलं होतं आणि त्याच्यानंतर दिल्ली युनिव्हर्सिटीमधनं PhD केलं होतं फार्माकॉलॉजीमध्ये. त्यानंतर ते इकडे आले. इकडे आल्यानंतर मला अगदी सगळ्या गोष्टी माहिती नाही आहेत, पण शिकागोमध्ये ॲबटमध्ये होते ते एवढं नक्की आहे. ॲबट, इलाय लिली किंवा आणखीन अनेक कंपन्यांमध्ये त्यांनी काम केलंय. 150च्या वर त्यांचे रिसर्च पेपर्स पब्लिश झालेले आहेत. शिकागोत असताना तर त्यांनी आमच्या मुलांसाठी ॲक्च्युली मराठी शाळा सुरू केली होती आणि आता अटलांटामध्ये जाऊनही अटलांटा महाराष्ट्र मंडळासाठी ते खूप काम करतात. आम्हाला सांगत असतात, दोघंही नवरा बायको खूप सक्रिय भाग घेतात महाराष्ट्र मंडळाच्या सगळ्या ह्याच्यात. आणि त्यांनी एक मोठी गोष्ट करायचा प्लॅन केला आणि ते करतायत आणि ते म्हणजे ब्लड क्लॉटिंग बद्दलचा अवेअरनेस, त्याच्याबद्दलची जागृती. आणि त्याच्यासाठी त्यांनी थ्रॉम्बोसिस ग्लोबल फोरम अशी एक संस्था स्थापन केली आहे आणि त्या संस्थेतर्फे ते थ्रॉम्बोसिस म्हणजे ब्लड क्लॉट किंवा रक्त गोठणं याबद्दलचे जागृती निर्माण करतात. आणि ह्या सगळ्या गोष्टी ते करतात कोणाला घेऊन? तर स्टुडंट्सना घेऊन. हायस्कूल आणि कॉलेजचे स्टुडंट्स त्यांच्या या संस्थेमध्ये आहेत. आता ही मुलं काय करतात? तर ही मुलं करतात ते म्हणजे पब्लिक स्पीकिंग, दे राईट आर्टिकल्स, दे प्रमोट all the research, whatever research is going on in thrombosis. They do internship about this in which college? Albany College of Pharmacy and Health Sciences. त्याच्याशिवाय लॉयला युनिव्हर्सिटीमध्ये त्यांनी मीटिंग्समध्ये कितीतरी प्रेझेंटेशन्स त्यांच्या मुलांनी केलेली आहेत. आणि ती मुलं ब्राझील, शिकागो, ऑर्लँडो, सॅन डिएगो, सॅन फ्रान्सिस्को, टोरॉन्टो अशा अनेक ठिकाणी जाऊन ह्याबद्दलची जागृती करत आहेत. आणि त्याच्यापैकी एक त्यांची शी इज अ व्हेरी ब्राईट स्टुडंट, शी इज अ ज्युनियर ॲट अटलांटा हायस्कूल, शिवांगी रंजन. ती त्यांना सहकार्य करणारे. शी इज गोइंग टू हेल्प हिम अँड शी हॅज डन लॉट ऑफ रिसर्च ऑन इट. डॉक्टर लद्दूंचे काही असे इथे काम केलेले स्टुडंट्स हार्वर्ड युनिव्हर्सिटीमध्ये सुद्धा आता मेडिकल स्कूलला आहेत किंवा डॉक्टर होऊन तिथे काम करतायत. असं हे मोठं त्यांचं कार्य चालू आहे, ग्लोबली चालू आहे. आणि आपल्या इंडियन किंवा एशियन लोकांमध्ये खरं म्हणजे हा रक्त गोठण्याचं किंवा हार्ट अटॅकचं प्रमाण नेहमी जास्त असं आपण ऐकतो. त्यामुळे आजचं हे लेक्चर आपण सर्वांनी अगदी खूप चांगल्या रीतीने ऐकावं आणि त्यांनी काय सांगणार आहेत ते आपण पाळावं असं मला वाटतं. तेव्हा आता डॉक्टर लद्दू आणि शिवांगी is in your hands.
Thank you, Rekha. Shivangi, can you please start the slideshow?
Yeah.
I would like to explain what Shivangi is. She is one of the brightest girls in Global Thrombosis Forum, but yet she is very shy too. You can see, and she probably is getting lost amongst the Marathi audience because language is a little issue for her. She speaks English, Hindi, but Marathi is a little bit challenge for her. I asked Shivangi to join because she has been working with GTF for 3 years, 4 years actually, and has done remarkable work. She, in fact, was one of the students who went to Brazil in October last year, and she made a fantastic job there. So coming back, the topic of today is understanding the blood clots as they apply to you. Naturally, you're going to say, well, why should they apply to you? Well, first of all, blood clots can happen to anybody. A lot of us do not understand that blood clots can happen to anybody. Our own grandson, Rajan, at the age of 11 years, he suffered from massive blood clots in the lungs. And by the time he was 22, with 3 blood clots in his lungs, God took him away from us. So you can see it can happen to anyone. And today we are not talking about who can get it. In general, everybody can get blood clot. Age, gender, race, nationality, they do not discriminate. There could be a difference in the incidence of blood clots in the various nationalities, races, but that's a different topic. Everybody can get blood clots. Now, when we came to know that we are going to have the Chicago Maharashtra Mandal people, I expected that most of us will be probably post 50 or post 60. Well, then we are in a very high risk category, and Shivangi will actually give you an actual demonstration how you are in the high risk category. So let me start this. Shivangi, can you please? Yeah. This is Global Thrombosis Forum logo. This logo was created by one of our high school students. Rekha mentioned that we have high school and college students. Actually, we only have high school students. College, by the time they go to college, they already have worked with GTF and they proceed to college. So kautukachi goष्ट अशी आहे की this is all the work is done by our high school students. So what role do I play? I happen to be there, just here, there, and just check with them, that's all. I don't have any job. It is the students who do all the work. Shivangi, next one. Okay, so now getting old. You know when you're getting old, when you barely do anything all the day, but still need to take a nap and continue to do anything. I don't know any one of you qualifies for this cartoon. Some of us do qualify. So that's old age. You have a choice. You don't do anything, or you can be very busy. One problem with this picture is that this person is lying down. And Shivangi will tell you, lying down for long periods of time is also very harmful. So if somebody says that in retirement, you sleep for 24 hours, don't do anything, that's very bad. We would not recommend doing that, and we'll give the reasons about that why. So you need to be active, sleep, take a good sleep, but you need to have a good balance. Shivangi, next. Well, you can go to the beach. Jayashree and I were on Hawaii Beach last year in March, and Jayashree loved that beach so much, she didn't want to come back. It was a great difficulty. With great difficulty, I put her back on the plane. So you can go on the beach and enjoy. That's one of the enjoyments you can have. Shivangi? Well, we're all getting old, let's face it. It's not a question of if, it's a question of when. And we have to accept that we are all getting old. Well, let's talk some positive points. There are some benefits. First of all, you retire. You don't have to go to work. and you don't have to be bossed by your boss. I made a definition of a boss, which I remember here. The boss is like a diaper. The boss is like a diaper, always around you and full of, you can fill in the blanks. So you're exempt from being bossed all the time. Now, some of us, like me, we are bossed by our respective spouses. That's different. Well, at least you're away from the boss. Well, you can travel to India, you can travel to some other countries, visit the places where you have not been. There, Yashri joke reminds me, this was joke on Lucy show, that Lucy, Shivangi, you may not remember this, Lucy show, Lucille Ball, long time ago. So Lucy says to her husband, Ricky Ricardo, honey, this is your anniversary, please take me to a place where I've never been. So Ricky says, okay. He takes her to the kitchen because Lucy never went to the kitchen and never wanted to do anything. So that's another thing you can do, places where you've never been. Well, you're independent. Definitely, you're independent. A lot of people I heard, they love to go shopping. Some of the people whose children are still young, Shivangi is one of them. And naturally, when I talk to her mom, she's a wonderful lady, Purnima. One of the things she told me, Kaka, she calls me Kaka. Kaka, I want to eventually get Shivangi married to a good boy. I said, okay, you're going a little too fast. Let her finish her high school. Let her finish her college. A time will come. But some of you definitely would enjoy getting married, your children. Now, this is a message to the ladies here. Many of you feel that when you become mother-in-law, you want to give, I don't know what treatment you want to give to daughter-in-law. Boss, I think a lot of Barasha Sasu Mantak, me, my Sunila Shikote Vare. So this will be a nice time for you to enjoy becoming mother-in-law, working with your daughter-in-law. Then enjoy grandchildren. We have 5 grandchildren and we enjoy every day. So there are a lot of things which the retired people can do. So retirement is not something to be taken as a very dark thing. A lot of us can enjoy. Next. Now, as we grow old, we need to understand that there are some issues which may come. It's not a question of they will come, but it may come. If you don't get, you're lucky, and we want to keep you like that. That is the function of Global Thrombosis Forum. We want you to be staying away from the blood clots, and there are several simple techniques you can do to prevent blood clots. Once the blood clots form, it becomes a very serious condition, and we want to acknowledge and make sure you understand that the blood clots are serious and let's avoid them. So in the legs, you can get a condition called deep vein thrombosis, DVT. In the lungs, as our grandson had, there are clots in the lungs called pulmonary embolism. In the heart, there could be a blood clot. Of course, everybody knows heart attack. In the brain, if the clot goes to the brain, the condition is known as stroke. So I think you heard some of them, heart attack for sure, stroke for sure, perhaps DVT and PE, you may not have heard. Would like to introduce you to these conditions. Next. Okay. Now this one probably will wake you up. Did you know that there is one blood clot formed every minute in this country? And there is a death due to blood clot every 6 minutes. Every 6 minutes, the clock is ticking and there is a death due to blood clot. Well, what about this? You know traffic accidents, you know AIDS, and you know breast cancer. Okay, so the deaths caused by AIDS, breast cancer, and thrombosis, they exceed the deaths caused by traffic accidents. I hope now it will give you an indication how serious are the blood clots. And yet, we have taken several questionnaires, several polls. Shivangi, maybe you can chip in. Can you chip in here? What did we find? The incidence of blood clots is high, but how about the knowledge about the blood clots? Can you mention a few things on this?
Yeah, so annually in the US itself, around 600,000 to 900,000 people have thrombosis. And unfortunately, many people die from thrombosis because once the blood clot dislodges, it's a very deadly disease. So there's that aspect of thrombosis that it's very, very, very common and widespread, but not many people know about it, which makes it even more dangerous.
So that is the purpose of Global Thrombosis Forum. I just took a statistics. We have talked to about 500,000 people in the last 11 years about thrombosis, made them aware. Most of them didn't know what blood clots were. And now they tell us they're very happy because they can take simple techniques to prevent the blood clots. Shivangi, next. I mentioned about this, so I can skip it. Rajan was 14 years, not 11. He was 14 at that time. And about 2 years ago, unfortunately, we could not save him. So it can happen to anybody at any age. Next. So the slogan of Global Thrombosis Forum is, it's in partnership with a large corporation called North American Thrombosis Forum in the community service for thrombosis. North American Thrombosis Forum is in Boston, and one of the world's greatest physicians, okay, Dr. Goldhaber, he started that, and we are an affiliate of North American Thrombosis Forum. We are a very small organization. NATF is a worldwide organization. Next. Okay, now let's talk about something. I've talked about age, gender, race, nationality. Let's ask a question. Do the Indian celebrities, Bollywood people, do they think they are exempt from blood clots? Next. Shilpa Shetty. Do you know Shilpa Shetty had blood clots? Go ahead, next one. Shilpa Shetty, she suffered from antiphospholipid syndrome, which can lead to blood clots. So you can see even Bollywood celebrities cannot be exempt. Go to the next one. Hrithik Roshan, does anybody know? Hrithik Roshan had multiple blood clots because the banging on his head. Go ahead, next. He got chronic subdural hematoma, which has resulted in surgery because of this multiple impacts which he got on his forehead during shootings. Next. Navjot Singh. Navjot Singh Sidhu is one of the great cricketers. And this is actually Navjot Singh in a hospital admitted because he had DVT. Next. He had DVT. Next. Here is a person I didn't even know, Praveen Kumar Sopti. But if you have seen Mahabharat's Bhim, he was Bhim. And this fellow had heart attack. Next. Do you know anybody, this lady? Surekha Shikri. She was a very famous Bollywood actress. She acted in Zubeda. Okay, go ahead, next slide. And she had atrial fib. She had CVA, which is called cerebrovascular accident, and ischemic heart disease. Serena Williams, everybody knows, but does anybody know that Serena Williams, she had DVT and PE when she delivered her second child? Go ahead. She had DVT and PE. Hillary Clinton, of course, everybody knows for various reasons, and she also got blood clots in the brain, and she's currently on brain thinners. Next. Next. So now question is, what causes these blood clots? So far, what we are told you is, well, blood clots are dangerous. They can happen to anybody. What causes the blood clots? So let's review that. As we get old, the circulation in our blood, circulation in the body whether it's arteries or veins, obviously goes slow. Blood flows slow. And a slow blood flow is a precursor for getting blood clots. Some of us are, I'm sure, eating healthy food. Some of us will not. And if we eat unhealthy food, clearly you know that the blood clots you're going to increase. We had a gathering last week, and Jayashree made puran pola, which is a very typical Marathi dish. And creating puran pola, we had already fried them with butter. But half of the people who came to our house, they added, त्यांनी तूप असं ओतून घातलं आणखीन त्याच्यावरती. Well, we didn't, of course, say anything. They're our guests, but I think a lot of butter is really not something good. You need to kind of take a hard look. I'm not saying that all of you should avoid butter or ghee, but try to be a little bit careful. Now, Rekha, a question to you. How many liters of water do you drink? Water, not Coca-Cola. I know you drink alcohol, but I'm not talking about that. I'm talking about water. Water, Rekha, can you tell how many liters of water do you drink every day? The recommended dose is 2 liters of water.
मी 7-8 ग्लास नक्की पिते, पण मी
Okay.
अल्कोहोल नाही पित.
Alcohol, oh, sorry. Jayashree told me. Okay, sorry. Okay, my fault. I withdraw that statement. But everybody should drink a lot of water. Some of these things we are talking are also preventive techniques for blood clots. A healthy diet is one, consuming lots of fluids is number 2. Then lack of exercise. In old age, our bodies getting frail, we get tired very quickly. On the top of that, that extremely acute desire of lying down all the time, all these things, they take a toll on exercise. So, Madhav, how much exercise do you do? Can I ask this question?
जरूर. साधारणपणे मी दररोज अर्धा तास ते 1 तास करतो, डिपेंडिंग ऑन बाहेर काय आणि काय चाललंय ते. पण मी रेग्युलर एक्सरसाइज करतो.
Fantastic, fantastic. See, you already are a candidate to prevent the blood clot because you take good exercise. Okay. Sleeping habits, as I mentioned, that person was lying on the couch. If that lying on the couch extends to 24 hours, then that's bad. Sedentary habits, sleeping too long, is another factor which can produce blood clots. Now, how many of you, I know because of retirement, we talk, people fly. The longest flights we found are Newark to Singapore, 19 hours, and San Francisco to Mumbai, 17 hours. Has anybody flown these long haul flights? And if you are, and if you don't take enough breaks on the flights, which is walking in the aisle, you are definitely a candidate where you may get blood clot, or even driving. For example, Prasad Atnikar, do you go for long drives? Prasad nahi hai ka? Baro. So if you go for long drives, okay, I mean, I did when I was young. I went from Chicago to New York. I finished in 1 day. That was stupid of me. Too far. You have to take frequent breaks. Okay, so that's very important, which can prevent you from getting blood clots. Next. Okay, so what are the risk factors which may promote this? Now, there are some things you can challenge. First thing is age. Well, age is a factor, but Rajan was 14. Well, how come he got blood clots? These are the common risk factors which have been identified. And Dhananjay is asking question, how long drive? Okay, so Dhananjay, answer is, if you go more than 2 hours without stop, without taking a break, that becomes too long. Take a break every 90 minutes to 2 hours, then you should be okay. The break should be about half an hour. Beyond that is going to be challenging. Gender. Well, although we said it can happen to males and females, we just showed you the pictures, some of them males, some of them females, but in general, females who are on oral contraceptives, they definitely are at high risk because oral contraceptives themselves produce an increased incidence of blood clots. Smoking, I don't think any one of you smokes, so that's out. Diabetes, I myself have diabetes, and if you have diabetes and you are on insulin, and Shivangi will show you how your risk score goes up very quickly, and she will going to show you a demonstration. High blood pressure, definitely. High cholesterol, well, high blood pressure, high cholesterol are two things you can definitely manage, prevent them, if not at least treat them properly. Lack of activity, we talked about this. Obesity, unhealthy diet, we talked about this. Now, some of the people have a family history of arterial thrombosis. If the person brings with him the genes which have the history, there's nothing we can do except you can be more careful because you are a prime candidate to get blood clots. Lack of movement, such as surgery after a long trip. I mean, Dhananjay, did I answer your question? Okay. Next, Shivangi. How can you prevent?
Yes, Atul, you did answer my question.
Okay, thank you, Dhananjay. Age, well, age is something you cannot control. It's because it's going to be an unending thing in your life. Gender, you cannot do that, of course. Oral contraceptives, especially for the ladies, young ladies who take oral contraceptives, we recommend that please make sure that you go and see your gynecologist on a regular basis and take the proper precautions. Smoking, obviously, don't smoke. If you are diabetic, then definitely take a good control of diabetes and take a good control of high blood pressure. Question, arterial thrombosis. Very good question, Milind. What happens is the thrombosis or the blood clots can happen in the vein, we call it DVT or pulmonary embolism, or they can happen in the artery. If it happens in the artery, such as heart attack, which is the artery in the heart, or artery in the brain, which is stroke. So arterial thrombosis is nothing but development of blood clot in one of your arteries. As you know, there are two types of blood vessels, artery and vein. So arterial thrombosis means blood clot in the artery. Shivangi? Again, how to prevent blood clots? High cholesterol. Well, again, you can make sure your diet is good. And some of us may still have high blood cholesterol. Well, then the thing is to go to the doctor, and there are some reasonably inexpensive, good, safe medications which can bring your cholesterol under control. There are two types of cholesterol, as you know, low density lipoprotein and high density lipoprotein. You want high levels of HDL and low levels of HDL. So I think your doctor can help you in bringing your cholesterol levels up to a level. Lack of activity, if you're there, you maintain the activity, Madhav, you're doing great. 1 hour or half an hour a day, that's fantastic. Unhealthy diet can be corrected very quickly. I know everybody likes sweets. I love sweets. Everybody likes pizza. But if you can keep that under control, that'll be good. If you have a family history, nothing can be done because it stays there. Lack of movement, etc. After surgery, keep on moving, and then you can prevent the onset of blood clots. Shivangi? What are the warning signs? One of the people in the last meeting asked me, what are the warning signs? Sometimes there are no warning signs, but many times there are. As soon as you get a pain in the leg or the chest or the brain, understand that this could be a precursor of something. So don't give it up. Pay attention. Most of you will take aspirin, maybe Tylenol, Motrin, that's fine. But if it doesn't work, don't wait, go and see your doctor. Leg pain is definitely, it happens in patients with DVT or tenderness, often described as cramp. Now, you might say cramp, oh yeah, I get cramps in my legs all the time. If the condition cannot be controlled by normal analgesics, which is Motrin or Tylenol, you need to see a doctor. If the leg becomes reddish or there's a bluish skin discoloration, or it becomes swollen and warm to touch, reddish blue color or warm in touch, and you can feel it yourself, then you're talking about something for which you need to go to a doctor. Next. How do you know that there are blood clots? Well, for heart attack, AMI is heart attack, P is pulmonary embolism, there is an acute unbearable chest pain which you absolutely cannot bear. The person almost cries, it's so unbearable. If it's a foot, then there is a swelling and redness, as I mentioned. Redness in the area I mentioned. A patient with acute myocardial infarction, heart attack, or PE cannot breathe. It's very difficult to breathe because the lungs cannot function properly or the heart cannot function properly. In a case of stroke, the person gets confused. He loses the balance. He may fall down, or his mouth can start drooling on one side. That is a sign that a person is probably getting stroke. Next. Is this your slide, Shivangi, or my slide?
Yeah, it is.
Is it?
So-
Yeah, go ahead, please.
Thank you, Azuba. So this essentially is a diagram of deep vein thrombosis, which occurs in the deep veins of the leg. And so in the very first picture, you can see a diagram of a healthy vein where the blood is able to seamlessly flow through the valve and through the vein because the valves are functioning normally and the vein itself is strong. However, in the next picture, you can see that the blood is beginning to pool because the valves are starting to weaken and the vein itself is starting to weaken. But when the blood begins to pool, it starts to combine and form a blood clot, as you can see here in the third picture. And when this forms, a part of the blood clot can break off and dislodge and form an embolus. And this is what we call thrombosis, when the blood clot dislodges and becomes airborne in the vein itself and forms an embolus. And so this blood clot itself can lodge anywhere else in the body. It can lodge in the coronary artery and cause an acute myocardial infarction or a heart attack. And as you can see here in this diagram, the coronary artery is blocked and it's not allowing the blood flow to go through and past the artery and into the heart, which is causing the tightness or pain in the chest because of the lack of blood due to the blood clot blocking the artery. Or the blood clot itself could go to the lungs. As you can see here, you have the blood clot right here as the embolus, and that's not allowing the blood to flow through into the lungs, and it's causing damage within the lungs because of the lack of blood flow and oxygen because the lungs aren't getting it because of the lack of blood. Or you can have a stroke, which is essentially when the blood clot will go through and cause it will form a blockage in the cerebral artery. And due to this, the blood will not receive enough oxygen because blood is essentially the carrier for oxygen throughout our whole entire body. It's a very important thing in our body, and without it, we will not have oxygen to be able to thrive and those organs to thrive. So here in a stroke, the brain isn't receiving enough oxygen because of the lack of blood flow, and the brain is beginning to die. So one big question you may be having is, how do you prevent blood clots? There are some things that you can do to prevent it and some things that you can't. Like your age, unfortunately, you cannot reverse your age, but you can maintain a healthy diet. Make sure that you're consuming healthy proteins, good fats, you're getting your micronutrients or macronutrients, you're making sure that you're drinking enough water, around 2 liters a day. You're making sure that you're active and you're exercising. You're going on a walk outside, or you're playing tennis with a friend, or you're going on a walk with your friend or family, and that you're keeping your body active and making sure that the blood isn't pooling in your legs. And also during long flights and long rides, you're getting up and moving around. Like if you're in an aircraft, you could easily get up and just walk around the aircraft for 5-10 minutes to make sure you're staying active and the blood is continuously going through your body and not pooling anywhere. And also you should take your medications as prescribed by your doctor. And one thing you can do is take your Caprini risk score. So one question you may be asking is, what is the Caprini risk score? Well, it was developed by Dr. Joseph Caprini, and essentially it's a test that accumulates your individual risk factors and puts the patient into 4 different categories of low risk, moderate risk, high risk, and highest risk. And so this test is very effective and has been tested and approved by several countries in the world as one of the most reliable techniques to detect the risk of thrombosis. The Caprini risk score has been published in major US and international scientific peer-reviewed journals. So why should you even take the Caprini risk score in advance, as in now? Well, the one thing is that taking your Caprini risk score in advance will help your physician to decide if you need surgery in the future to decrease your chances and risk of developing thrombosis and to make sure that you're as healthy as you possibly can be. There may not be enough time for your physician to take your Caprini risk score in your doctor's appointment to determine if you need surgery. And additionally, it'll help you and your physician to know your Caprini risk score in advance so that he or she can administer the proper treatment so that you are as healthy as you possibly can be. So how can you take your Caprini risk score? We can definitely help you with that today because I will demonstrate in the next slide how to do it. And it's essentially by participating in a survey that has been approved by the Institutional Review Board of the DePaul University. And the survey only takes a couple of minutes and does not ask you for any confidential information, such as your name, address, social security number, or phone number. So it's very easy and it's very easy to access as well. So essentially what you will do is click on this link of tinyurl.com/Caprini risk, and I'll demonstrate this right now. So once I click on this link, it'll take me over here to this website. Can you see the website?
Yes, we can.
Yes.
Okay.
Yes.
So once you go to this website, it'll ask you to enter a password, and the password, it's also in the PowerPoint. It's in capital KYCRS. So that's KYCRS.
Which is know your Caprini risk score.
Yeah. So once you do that, you should log in, and then it'll take you to this screen, and you will go all the way down to a place that says click to take your risk assessment. So once you click on this, you will see the screen. It essentially has all of the risk factors that will accumulate to tell you what your Caprini risk score is. So let's take this right now. And so what is my race? I am Asian. What is my highest degree of level of education? I could say prefer not to say, or I'm a high school student, so I will select that. And then what is my annual household income? I will say prefer not to say. You can say prefer not to say for any of these personal questions. And what is my gender? I'm female. And since I'm not doing any of these, I will not click it. And what is my age? I'm 0 to 40. So within the medical history, I will read through, and that since I don't have any of these conditions, I will not click them. And same thing for medical conditions. But for the sake of demonstrating it, I will click a few of the random ones. And you can see the moment I clicked that I've had a cast, it shows that my score has immediately increased. And at the end, those increases will reflect in your Caprini score. So for blood clot history, if I were to select someone in my family has had a blood clot, you see that it immediately increased from a 2 to a 5. And so it shows the importance that certain risk factors have. So having blood clot history means that you have a higher risk of having thrombosis. And so I will keep scrolling down. As you read through, you will select what you have had within the past month. Like, have I broken my hip or my leg in the last month? And based on selecting these, it'll increase my risk according to whatever I have selected. And then as you go down, it'll ask you for body mass index. And so I am 120 pounds and I'm 5'5". And so based on my BMI, say that if I'm 500 pounds and 5'5", it increased my risk according to that. And then the last one is smoking, diabetes, chemotherapy, blood infusion, or HIV. I don't have any of these. So once you're finished with selecting whatever, you press submit and review your DVT risk. And so as you can see, my fabricated score is a 5, and that puts me at a high risk based on whatever I selected within the survey. And so it says that my risk is high. And I should be wary of this, and I can download and print my score report as you should, and show that to your doctor so that they know what to do from there, and if there are any precautions or future steps that need to be taken to prevent you from developing thrombosis in the first place. And after I download PDF and print it, I can start again for the next volunteer to take their risk factor test as well, and it takes me through the whole entire thing again.
Shivangi, take my thing. Let's put myself. I just want to show them how one condition can change it. So I'll give my real numbers. So please, okay. So I'm an Asian, masters above. Next, I will not say male. I am in the last category, 75 plus. Now you see how the score is going up. Okay, immediately, and I put 75, it goes up to 3. Go ahead. Okay, nothing here, but put down the second one. Yeah, now look at this. Because of the genetic condition which we have in the family, it goes up to 6. Okay, go ahead. Nothing here. 180. 5.7. And then additional risk factor, diabetes and insulin. Look at this. So my score now is 8. And let's evaluate what risk factor do I have. I'm in a high risk category. So I have to be careful. Now this score, I can print it and take it to my doctor, which is what we recommend all of you. Take the test at home and keep the one copy with you, keep it to the doctor, because in case of emergency, you will not have enough time, or the doctor will not have enough time to assess your risk assessment. So best thing is get in advance and show it to your doctor. Is there anybody, Shivangi, you want to, somebody volunteers here?
Shivangi, can I have a website name again, please?
Yeah.
We're going to give all that, but you can write that down.
Mm-hmm.
Or put in chat box, Shivangi.
Okay,
Put in the chat box. And put that password also.
okay.
We want all of you, and try to get as many people as you can to do it, and keep the printout. Last time Subhash Devdar volunteered, and I had sent him the printout. So any one of you, I would recommend each one of you take it at your leisure at home and do that, because you'll be doing good to yourself. And again, you're not giving any confidential information. Of course, your information does have, the physician does have that, so that's not a problem.
Yeah. Okay.
Any questions so far for Shivangi for the Coprini risk score questionnaire? And by the way, this is a research project. So far, Shivangi and her colleagues have finished 2,000 people questionnaires. And based on that, they have come out with some outstanding and amazing results. One result is Asians, they have very high risk score typically. That's one. Number two, many of the Asians, they have very high incidence of diabetes. That's 2. 3, they do not smoke. When we compare the Asian Indians with the Caucasians and Latinos and African Americans, we found that these 3 races, their smoking rate is very high, which means that goes again in increasing their Caprini risk score. Shivangi, go ahead, please.
Okay. Okay. So why should you take the Caprini Risk Score DePaul questionnaire? As I explained, we have so far collected around data points from around 1,000 different
Actually,
cases.
2,000, yeah.
And the results are very amazing. And your participation in the project will help our research in this very important segment. It will help fellow citizens in reducing the risk of thrombosis overall and help decrease the widespread aspect of this condition. So one thing that if you do unfortunately contract thrombosis, there are different things that you can do to manage thrombosis. There is bed rest for adequate amounts of time as prescribed by your physician. You can take anticoagulant drugs or blood thinners, such as warfarin, heparin, apixaban, and rivaroxaban. You should definitely follow the instructions of your physician. And also, if you do happen to have deep vein thrombosis, you should use compression stockings and IV filters. You can use, if you have pulmonary embolisms, you can use anticoagulants and embolectomies. If you had a myocardial infarction or heart attack, you should use platelet drugs, anticoagulants, nitrates, beta blockers, statins, reperfusion therapy, and physical therapy. Additionally, aspirin and other antiplatelet drugs can also help you. For thrombolysis, you can use tissue plasminogen activators, which are most effective if started as soon as possible after the stroke occurs, and usually within 4 to 5 hours. You can go through thrombectomy, and also anticoagulants such as warfarin, apixaban, dabigatran, edexaban, and rivaroxaban can also be used. You should manage your blood pressure, and also physical therapy will greatly help you. And so in the past, we've seen that advertising is a very important and very powerful tool that has been used in the past, whether it's through Pantene's campaign of Don't Hate Me Because I'm Beautiful, which allowed them to become more widespread and well-known with their products in 1986, and even now Pantene is very widely used. For Morton Salt, they had their campaign of When It Rains, It Pours in 1911, and now Morton Salt is one of the most commonly used salt brands that in the store. And so it's important to spread the word around, and that with this campaign that the Global Thrombosis Forum is essentially doing is to make sure that more people know about thrombosis, because more awareness will help us get closer to making this disease less widespread than it already is, and taking that number of 900,000 thrombosis cases per year in just the US to significantly lower. So what's next is, are there any plans to include such a session in the BMM in 2024? And also, we would like to sincerely thank Ms. Rekha Dehodar and also the Maharashtra Mandal of Chicago for allowing us to use this platform to spread awareness of thrombosis and spread GTF's message of making sure that thrombosis is well known and to decrease that risk that people have. So thank you so much. And does anyone have any questions?
There are two questions, Shivangi. First, can you please put the website and the password into the chat box?
Yeah, I did earlier. Let me repost it in the.
Okay, she will do that right now. The website and the thing, because I would really like as many of you to take the questionnaire. It will do a couple of benefits. One, you will know your risk score. You will give it to the physician, so he knows in advance, so you are ready in case of emergency. And number two, it will help the research project, because we derive data from such questionnaires. So it will also help us.
Yeah.
Okay, so you did put that. Okay. The second question was asked, varicose veins. Can you please ask me, can you please tell me what exactly would you like to know of varicose veins? I forgot who asked that question. I made a note of that. Varicose veins, what about it? Is this a risk to DVT? Is that a question? And that is the question. No, varicose veins, unless the varicose veins are very, very severe they don't pose much risk. But yeah, it is always good to make sure that the varicose veins are treated properly. We don't want to let the varicose veins go beyond control. Okay.
Dhanyawad, Dr. Ladu and Shivani. What I will ask now our Vivek Waluns to do the vote of thanks. त्याच्यानंतर मग आपण बाकीच्या प्रेक्षकांना काही प्रश्न उत्तर असतील ते आपण घेऊया.
Yes.
विवेक.
थँक्यू माधव दादा. सर्वप्रथम मला डॉक्टर अतुल लड्डू तुम्हाला खूप खूप धन्यवाद द्यायचे. आपण आज वेळात वेळ काढून आज खूपच छान मार्गदर्शन केलं. आपण सर्व प्रेक्षकांना आजच्या मार्गदर्शनामुळे सगळ्यांना फायदा होईलच. पण आपण जो अप्रोच आज घेतला तो खूपच छान होता. म्हणजे आपण म्हणजे रूट कॉज आधी सांगितले, मग रिस्क फॅक्टर्स काय आहेत सांगितले, मग प्रिव्हेंट कसं करता येईल ते सांगितलं, आणि शेवटी हे कॅप्रिनी रिस्क स्कोर ह्याच्यामुळं आपल्याला आपला स्वतःचा स्कोर आपण स्वतः पाहू शकतो. हे तर खूपच फायद्याचं आहे. तर आपले खूप धन्यवाद. थँक्यू व्हेरी मच.
शेअर स्क्रीन काढू शकाल का ठेवायचा क्वेश्चनर तो?
Oh, taking aspirin is a good advice to blood clot from Nandini. Well, aspirin is lately in the last 5 years has become a little controversial. About 5 years ago, aspirin 81 milligram small dose was recommended for every person post 50. Lately, there have been some controversial reports that aspirin is not so good, should not be taken. So my recommendation is, I'm still taking aspirin every day, 81 milligram. Jayashree, she's 77. She's also taking it every day. So that's our thing, despite all the controversial results. My recommendation would be, please check with your doctor to find out. I think instead of my giving any recommendation, best thing is to check with your doctor. Okay.
Shivani, unshare your screen, please.
Yeah.
Any other questions in the audience?
हॅलो.
बोला.
अतुल जी, मी डॉक्टर तलाठी बोलतोय. व्हेरी नाईस प्रेझेंटेशन. I must say that you and Shivangi are inspiring to us. And, I go to India quite often, so I'm going to relate these things to my Indian friends whenever we meet, and I will spread the message. Thank you for good
very
message.
much. Thank you. Question to Madhav. Would you like this PowerPoint to be shared with you, and then it can be shared with everybody? We are very open for that.
Zarur. That will be a great idea.
Please do that. Please
people,
do that.
they did ask me, and please send that to me, and then I will be glad. I will be glad to share with all our viewers and plus our some of the groups. And that again, I would like to really commend you. तुम्ही अतिशय सुंदर उपक्रम सुरू केलाय हा. अगदी दर 6 मिनिटाला अमेरिकेमध्ये ब्लड क्लॉटमुळे कोणाचा डेथ होते. हे खरोखर अगदी आय ओपन करणार आहे. अँड रिअली व्हेरी व्हेरी नाईस. शिवांगी, you are also great. I know the young people we want, and I'm sure by looking at you today, some of our young viewers are they will definitely impress with this, and it is really good. Thank you again.
Thank you so
it's
much.
eye opening.
माधव दादा, शशिकला ताईंना काहीतरी प्रश्न आहे.
एक नंदिनीचा प्रश्न आहे, तो मी विचारतो, उत्तर देतो मी. आय नोटेड, बट गो अहेड. शशिकला, व्हॉट इज द क्वेश्चन?
शशिकला ताई, जरा अनम्यूट करा.
बरं, मी नंदिनीचं उत्तर देतो. Nandini asked a question, aspirin and Plavix, what is the difference? There is a lot of difference. Plavix is a much stronger medication, and it is given when there is actually a blood clot. So aspirin is usually for prevention. Plavix is usually given for treatment. So before you decide whether aspirin or Plavix, please talk to your cardiologist, which one would be applicable to you. Do not interchange aspirin and Plavix, because Plavix is a very strong drug. It could be very toxic also. Please check with your physician before you do that. Okay, Shashikala, you said has a question.
Yeah.
आणि माझा प्रश्न असा आहे, बेबी एस्पिरिन is enough for preventing the right? आणि जर बेबी एस्पिरिन घेतल्यानंतर तुम्हाला स्किन रेड किंवा असं ब्लड दिसलं म्हणजे रेड, should we stop taking baby aspirin? This is one question. Secondly, do we have to take baby?
मला ऐकू नाही आलं, माधव. Did you hear that? There was a lot of breaking.
तुमचा आवाज एको होतोय थोडासा. बाकी काही बाजूला असेल तर बंद करा, म्हणजे फोन.
या किंवा शशिकला ताई तुम्ही याच्यावर पण टाईप करू शकता चॅट मध्ये.
Maybe you can type on the chat box, then I can answer.
शशिकला ताई टाईप करेपर्यंत जर दुसरा कोणाला प्रश्न असतील तर
Can
विचारा.
you please type in the chat box, then I can answer looking at it.
I think सचिताईंना प्रश्न होता की baby aspirin is sufficient or as a preventive medicine, or do we need to have aspirin only? I think that is what she asked.
Well, baby aspirin is the same as small dose of aspirin, 81 milligram. And now don't confuse that with the aspirin in India. In India, the baby aspirin is not 81 milligram. I think it's much higher, probably 100 milligram. But baby aspirin is good for people over 50. But there also I gave a precaution that you need to talk to a doctor. There has been a fair amount of controversy through publications in the last 5 years. Did that answer your question, or did I not answer? Please let me know.
डॉक्टर लाडू, मला एकाने प्रश्न विचारला प्रायव्हेटली की ज्यांना ॲस्पिरिनची किंवा त्यासारख्या ड्रगची काही अलर्जी असेल तर त्या लोकांसाठी दुसरा काय उपाय?
If there is an allergy to aspirin, there is not much thing there. But there are very few people who are allergic. Aspirin is usually very well tolerated, but you're right. Some people may not. In that case, best thing is to check with your doctor. I don't have any solution for that.
Thank you.
Can I share something?
Yes.
My husband विवेक, त्यांना ॲस्पिरिनची ॲलर्जी होती. तर त्याचा खूप त्रास झाला. पहिल्यांदा जेव्हा हार्ट अटॅक आला होता त्याच्यानंतर ॲस्पिरिन चालू झाले, प्लॅविक्स नंतर ॲस्पिरिन. मग इथे नॉर्थ वेस्टर्न मेडिकल फाउंडेशन मध्ये ॲस्पिरिन डिसेन्सिटाईज करून घ्या म्हणजे त्यांनी रेकमेंड केलं. आणि त्यांनी मग व्हेरी 1 milligram ॲट अ टाइम पॉइंट असं करत बेबी ॲस्पिरिन वर आणलेलं. अँड लास्ट 10 years he's on baby aspirin.
Okay, yeah. See, baby aspirin is 81 milligram, and the real dose is much higher, 325 milligram. So I think if your husband can tolerate baby aspirin, that's good. I think you did mention about heart attack, right?
Yeah, yes.
So after heart attack, Plavix definitely would be recommended. Aspirin 81 milligram is also very, very good.
ते प्लॅविक्स सूट नाही झाली काहीतरी, त्याच्यानंतर ॲस्पिरिन रेकमेंड केली. 1 वर्षभर ॲस्पिरिन घेत होते, त्याच्यानंतर ते ऑल ऑफ अ सडन ॲलर्जी स्टार्ट झाली.
Okay, okay.
And then it was recommended by like to
But
desensitize.
is he doing okay on 81 milligram?
Yes, it is going quite better now.
Okay,
Thank you.
that's good. If he's steady on 81 milligram, I'm happy. Very, very good.
Yeah.
Okay, आणखीन काय प्रश्न? Any other question? I was surprised that let's ask some questions to Shivangi. I mean, we brought her specially here. So can anybody ask Shivangi a question? And don't worry, she will answer. She's smart.
Shivangi, thanks for, doing this. We really appreciate. Now, will you give some background about how you guys do the research or what kind of service you are providing to the third world countries or anywhere?
Mhm. So I've been with GTF, like me specifically, or with GTF?
It doesn't matter. Your whole group as well as you,
Mhm.
how you are, spreading this good work and helping humanity. Yes.
Yeah. So essentially what we do is that when we do research, we use our resources that Gaga gives us and also the online resources that we can get, because there's a lot of databases online that we can go through and get our data. Because when I went to Brazil last October, I researched vaccine-induced immune thrombotic thrombocytopenia. It basically was the blood clot formation as a result of the COVID-19 vaccine, like the Johnson & Johnson and the AstraZeneca vaccine, the very rare blood clot formation that happened. And so through that, we essentially researched what happens in the condition, because it's a very rare condition that's not very well known. And we were able to basically correlate it to a very related condition called HITT, or heparin-induced immune thrombotic thrombocytopenia. And so they're very related conditions, and we were able to research it. And then our main goal is to spread as much awareness as we possibly can about these conditions that people don't really know well about. So other things that we've done in GTF are booth presentations. So at the Suwannee Fest or at different events that are happening around our area, we've been setting up booths and basically spreading more awareness about thrombosis and what it is and how people can prevent thrombosis from forming for them and also for their family members as well. So
Shivangi is very humble. Shivangi, would you like to tell the group about your big honor which you received in Porto Alegre?
yeah, so in the Brazil conference at the International Union of Angiology's 30th World Congress, I received the Dr. Brij Bihari Lal Mathur Scholarship for the Best Presenter Award there.
Good job.
Thank you.
Very good. Congratulations.
Congratulations.
Thank you.
Very noble cause, you are doing this. It's आणखी कोणाला आहेत का प्रश्न?
सॉरी, लॉंग फॉर्म काय GTF चा? सॉरी.
मी लिहितो इथं, पाठवतो मी इथे. I'm putting on the chat box. I'll put the website also. We have a website and it's fairly well managed. So you can go on website and get a lot more information about GTF. Alka, did you see that?
नाही, अजून नाही दिसते मला GTF ची.
Chat box मध्ये टाकलंय मी, chat box.
अच्छा, मी बघतीये. लॉंग फॉर्म ऑफ GTF बघते.
Oh no, it's actually to Madhav.
Okay, to everyone.
मी असं करतो, sorry. मी सगळ्यांना पाठवतो.
Yeah, thank you.
I will send it to everyone. Just a minute. My fault. Yeah. Now it must have gone to everybody.
Yeah, it is. Thank
Now
you.
you can see it, right? Yeah.
Yeah.
Yeah, you can go on the website. It's very informative. We are about 11-year-old baby. It's very young baby still.
I posted one question.
Yes.
If a blood clot was found right after COVID infection, is there always a risk of having a blood clot?
COVID is one of the conditions, we have studied it quite a bit. It has a high incidence of producing blood clots. Yes. So we have to be very careful after COVID. And sometimes the blood clots can come a few weeks after. So yeah, COVID, I would recommend if you have COVID, be very careful and keep in touch with the doctor.
So basically, that blood thinner was recommended because the clot was found after COVID. Doctor recommended to take it for 3 months, and then later on it was discontinued.
Yes.
But how do we manage that, or how do we take precaution? What else can be done, or is there always a risk that you will get the blood clot again?
Okay, so after COVID, you said you were given blood thinner. What blood thinner was it?
My husband. What was it?
Okay. What was the husband?
Xarelto.
What was the medication?
Xarelto.
Okay, Xarelto. It's a DOAC, direct oral anticoagulant. If the drug was given for 3-4 months, and then the doctor said it was not needed, I think you should be okay, because this is not something, a condition of DVT or stroke. Then in that case, this Xarelto should be given for a long period of time. But in your case, I think you're okay. It was given for a few months. Immediately after COVID, it was withdrawn. Then I think you're okay. I don't see any issues there.
Okay,
Thanks.
thank you.
Thank you.
Okay.
Are there any other questions?
नाही, क्वेश्चन तरी नाही आहे, पण स्टील thank you, Dr. Laddu and Shivangi. It was very informative session, and it's a very common scenario nowadays. I see in many of my friends, parents, and my relatives. So I think this is a good informative session. Thank you very much, and thank you, Maruda, for bringing this.
थँक्यू प्रसाद. आमचा मधीच राहिलं पूर्ण वोट ऑफ थँक्स करायचं, तर मी डॉक्टर लड्डूंनी लगेच सुरू केलं. मी विवेकला पुढचं सांगायला सांगतो. विवेक प्लीज.
हो. तर डॉक्टर लड्डू, परत एकदा तुम्हाला तुमचे खूप खूप धन्यवाद तुम्हाला. शिवांगी, इट इज सच अ प्लेजर टू हॅव यू टुडे. You are doing a fantastic job.
Thank you.
Thank you so much for your contribution today. मला पुढचे आभार प्रकट करायचे ते रेखाताईंचे. रेखाताई, तुम्ही आज आम्हाला आजचे व्यक्ती आणण्यास मदत केली, आणि आजच्या फ्लायर बनवण्याबद्दल त्याच्यासाठी पण तुमचे खूप खूप आभार. तुम्ही आम्हाला सगळ्यांना खूप नेहमी प्रोत्साहन देत असता. सो थँक्यू सो मच फॉर ऑल दॅट. त्याच्यानंतर मला आभार प्रकट करायचे महाराष्ट्र मंडळ शिकागो, प्रसाद आथनीकर, खूप खूप आभार. आणि त्याच्यानंतर आपले फॉरेव्हर यंग ग्रुपचे आयोजक माधवदादा तुमचे, काश्मीरा मगर तुमचे, दीपाली सावंत, ज्योती गोगावले, प्रसाद आथनीकर, सगळ्यांचे खूप खूप आभार. त्यानंतर मला धन्यवाद द्यायचे ते तांत्रिक मांत्रिक टीमचे, आणि सगळ्यात शेवटी सर्व प्रेक्षकांचे. तुमच्याशिवाय कार्यक्रमाला शोभा कधीच येऊ शकत नाही. आज मोठ्या संख्येने सगळे या कार्यक्रमासाठी आला, तुमचे खूप खूप आभार. थँक्यू व्हेरी मच.
धन्यवाद विवेक, तुझे आभार. आमच्या टीमवर नवीन सदस्य, तुझे वेलकम आणि धन्यवाद. मंडळी, आता जर कोणाला काही शंका किंवा प्रश्न नसतील तर मी विनंती करतो प्रसादला की आपण हे थांबवा